Betty, who's a specialist physiotherapist from Spring Clinic. It's really helpful. Unfortunately, I can't introduce him on this webinar. I have to my best with his slides. So just an overview of what we're going to talk about. We're going to just go through the pain fear cycle again, talk a bit about the pain buffer, discuss mindful movement, the importance of pacing and goal setting, managing temporary increases in pain, and look at some resources to help. So I think the one thing that we really know is how beneficial movement and activity really is. You know, if we had a pill that could do all these things, we would prescribe it for everybody. So we know that being active reduces inflammation, it increases your mobility, it can reduce joint stiffness, it leads to increased muscle strength and reduce muscle spasms, and also the risk of becoming deconditioned or unfit. It can improve your sleep. It can reduce and manage stress, improve your mood. It can also create a distraction if you're being mindful. It can help manage your weight and reduce depression and anxiety. It's also really good for your physical health. Apart from pain, it can reduce your blood pressure and reduce your risk of heart disease, stroke, dementia. So lots and lots of benefits of being more active. I think the other thing to say about activity is that you often get the most improvement in your health if you're starting from a really low starting point. And as you start to increase up your activity levels, that's when you see the steepest improvement happening. You do still get a continued improvement as you increase your activity up to the government guidelines, which are available on our website. But it's in that very first section from nothing or very little up to a bit more that we see really the biggest improvement. So if you're really not active at all, don't be put off. It's really worthwhile just increasing your activity level to whatever you can. Will still get benefits, and hopefully over time you will be able to increase your activity further. Yes, so there's not one pill that can do all of these things. So we've talked before about the pain and fear cycle, and obviously for this you can have concerns that the activity is actually causing more damage in your body. This is generally not the case, as we've discussed before. Actually, all the evidence suggests that movement is actually really good for helping to reduce pain. So looking at pain and fear, specifically around movement, also the pain makes you worry that you might be damaging yourself, which makes you move less, and activity becomes more difficult over time, which reinforces the idea that your pain is stopping you from being able to move, and then you get increased stiffness and tightness, which leads to more pain, and so you can get into this vicious cycle. So there's really two different vicious cycles you can get into. The first is probably more common, which is underactivity. So you have pain, you worry that because you have pain when you move, that's causing damage to your body. So you do less, you lose fitness, and you have more pain. So this is very, very common. But we also see the opposite, where people have pain, they try to ignore it and carry on, and this just makes your brain even more sensitized to the pain, because it's reinforcing to your brain that activity is going to make your pain worse. So that's not a particularly helpful cycle to get into. So just to touch on this thing called the pain buffer. Now, this is actually something I only found out about a couple of months ago when we were doing the research before we started the pain courses, on our website, which you're obviously watching this, just a couple of headings down, there's a section entitled osteoarthritis, and there's a couple of links to flipping pain or flipping arthritis webinars. And the first one, the speaker really explains a lot about the pain buffer. But basically, we have basically a true tissue capacity, which is what we could actually do before it would lead us to cause damage to our body. But obviously our brain doesn't want us to get to the point where if we go even one step further, it's going to cause damage. So there's this thing called a buffer, whereby the pain starts before we're at the level that we would actually injure ourselves. So once again, the brain is protecting us from injury. But what we now know is that while your true tissue capacity can be reduced by osteoarthritis, by deconditioning from chronic pain, and also obviously perhaps more acute injuries or things. But what happens in chronic pain is that this buffer is massive. So your brain is basically overprotecting you. So when you're trying to move, it's sending these danger signals to your brain. But you can see clearly here that it's overprotection. And so even really low activities, the brain starts to perceive those as painful and sending messages of pain. So this buffer is influenced by fears, anxiety, negative thoughts around pain, sleeping well, inflammatory food, and sleep and inflammatory food is what we're going to talk about in our next webinar. It can also be influenced by poor social interactions, your own experiences around movement and pain, and also massively by lack of movement. So moving on to mindful movement. Now, unfortunately, I don't have Julio here to explain this to us, which he did amazingly. So this is an exercise in the traditional sense. It's really when you make movements or undertake an activity, you're being much more aware of how does this actually feel in your body. Not necessarily just as it's sore, but you're just thinking, oh, how does that feel? Does it feel a bit stiff? And really thinking about what sensation you feel when you move. And it can have long-term benefits of improving fitness and flexibility. So when you're doing mindful movement, you can do it sitting or standing. You can adapt it to suit your own needs, and absolutely never push yourself too far or too fast, because that will just increase this feeling that movement causes pain. It's very important to just gradually increase your range of movement in a way that you feel comfortable. And the thing that's really important is the quality of your awareness. So actually really paying attention to what you're feeling. Moving on to what you really helpfully explained as hard and soft edges. So this is about striking the balance between pushing too far and not pushing enough. So the soft edge is the point where you first feel a sensation of stretch and compression. And it's okay to stay in that zone. But the hard edge is when you feel like you're really forcing the movement, starting to feel really uncomfortable. We wouldn't want you to be pushing to that level. You're much better going somewhere in between the soft edge and the hard edge and staying comfortable and confident. So just to try and demonstrate that, if you imagine if I take my finger and I push it back, I'm aware that I'm pushing back, and I'm aware of a sensation of stretch and compression, but it's not particularly sore. It doesn't feel particularly uncomfortable. But if I keep going back, now I'm aware that I'm kind of pushing the movement. So when you start to feel that sensation that you're pushing the movement, just come back to a place where you feel reasonably comfortable, and then just gradually work at that level until you may find that your hard age, you can do more before you reach that. Just to really try and reinforce to your brain that you are safe. So pacing we discussed in an earlier model. Obviously, it's really common when you have a better day that you do a lot more than you usually do. And that's great because you can get a lot done. But the problem is that often the next day or two or sometimes even three, you can feel really, really sore, and so you do a lot less. And so you're actually then starting at a lower level, have a better day, and push yourself again, but this time you're not even getting the level that you were, and then you're really, really sore for several days, and all the time you're actually just reinforcing to your brain that movement or this activity is causing your pain. Whereas if we do what we call base and pace, start just slightly, just around that soft edge that we talked about, and then stay in that zone for a week or two, and then just gradually increase things up, and you'll find that actually you do come away from your baseline, and your pain may get temporarily worse, and then you just reduce your activities, always paying attention to whether you're pushing against a hard edge, or you're still in that soft edge. So once again, pacing is the difference between having to stop and choosing to stop, and obviously psychologically that's a massive difference. I think the other thing is, when you're thinking about activities, it's really important to connect with something you enjoy. If you've always hated swimming, that's not the right activity for you to pick. But if you enjoy gardening or you enjoy being outside, you might want to pick an outside activity. Some people find it helpful to take photos from the night if it's a distraction, walking the dog, walking with other people, or doing a physical activity with other people, often makes it more enjoyable. I think the other thing is that in this day and age, we're often really sedentary. We can do so many things without moving out of our seat, and it's really important to break up a sedentary lifestyle. So try and build in breaks where you go and make yourself a cup of tea, or go to the toilet, or have a pause, or have a break from your phone, and just move around a bit, because sitting in one position for long periods of time does tend to just stiffen up and feel sore. And I think it's important, that you experiment. What are your own tolerance levels? And it's often trial and error. Nobody's going to get that right first time. You try some things, you think, oh, that didn't work for me, or actually I felt much sorer after I've done that. The next time I'm just going to do a little bit less. And really think about how it felt for you when you were doing these things. And also, it's important to let your family know what you're doing. Often your family might try and be over encouraging and try and suggest that you do things that are maybe a bit much for you, or on the other hand, they might be really concerned for you and be trying to protect you too much, and not let you try and just build up that activity level. So what about temporary increases in pain? I think it's important to go back to all the principles that you've learned. Remember that you're safe. Think about some of the things that have worked for you as you've been working your way through these webinars. You might find that because you've been doing much better, you haven't been doing that as much, and maybe going back to that. Remember to mind your language again. It's really easy to think, oh, that's my pain back again, it's never going to go away, I can't do this, I can't do that. It's just about remembering to say, maybe today that would be quite difficult for me, but hopefully in the next few days I might be able to get back into that. It just, it just gives a slightly different slant. The other thing we talked about is cognitive soothing. Imagining that you're talking to yourself the way you would talk to a close friend or family member or child, just reassuring yourself that you are safe. Breathing exercises, which there's links to in the first two sessions, 2 and 3. They can be really helpful if your pain's worse. Visualization again can work for some people. And sometimes heat can help with temporary increases in pain. And underneath the first webinar, there's a link to Lee's website, his Partner in Pain website, and there's a panic button there when you're having a temporary increase in your pain. There's loads of really helpful resources. And I think, it's good to have all these things in your toolkit so that you kind of know what you're going to do if pain gets worse, rather than suddenly finding yourself in, quite severe pain and thinking, I don't know what to do, but having a bit of a plan can be really helpful. So just to confirm, this is the osteoarthritis section of the website, where the flipping arthritis with the pain buffer video is. And leading an active lifestyle can be many things. It's really just about moving more, ideally moving more in a way that's enjoyable for you. I have to be honest though, I'm not sure I would be out walking my dog in 9-inch heels, but that's entirely up to you. So just to go over again, these are all the benefits of being more active. Reduced inflammation, increasing mobility, increased strength, reduced muscle spasms, improved sleep, reduced stress, improved moods, weight management, and also reduced depression and anxiety. These are a couple, sorry, there's no pill that can do all that. And these are a couple of resources that Julio shared with us. And these are different exercises which can be really